Hello, my name is Darush, and I'm a pharmacist based over in Northwest London and also North Central London. Been a community pharmacist for many, many years. So during the COVID pandemic, of course, there's been a lot of work around trying to optimize people's inhaler technique, and even prior to the pandemic. But during this time, we've noticed an upsurge in people getting prescriptions for preventative treatments, which is great news, and some patients also getting reliever treatments too. But what we have noticed during this time is the amount of prescriptions for spacers has gone down a lot. And one of the things that we need to all be aware of is that inhaler technique is very, very difficult to do for us healthcare professionals and patients, especially when using a metered dose inhaler by itself. So if a person is using a metered dose inhaler, ideally that's with a spacer every time with optimal technique. And of course, coaching by a skilled healthcare professional, including pharmacists, nurses, and doctors, for example. So this project is very much, or pilot is very much looking at increase awareness, because pharmacists are very, very good at health promotion and making every contact count. As healthy living pharmacies, what we can do is engage patients who, for example, come in with prescriptions for metered dose inhalers, and we can identify if that person has got a spacer with that metered dose inhaler. So what's in the spacer pack? So one of the forms we've got initially is a checklist, a spacer checklist, which is really all the things we need to think about when it comes to making every contact count. Being that spacer guardian, the things where we can get the whole team involved as well. In the pack, we'll have what we call a spacer opinion questionnaire, which is something that once a prescription for a metered dose inhaler comes into the pharmacy, whilst the person is waiting for their prescription for their metered dose inhaler, the patient can fill out this very patient-friendly questionnaire, just 5 questions around their own current spacer use. Another item in the pack will be if a person does not have a spacer, whilst they're waiting for their metered dose inhaler prescription, they can read about the advantages of what a spacer will do, in addition to what the metered dose inhaler that they're on, either for their asthma or COPD. In the pack, we'll also have a letter just to highlight to the local practice to inform them that this is the pilot or project that's being involved in the community pharmacy, and how valuable our role is as community pharmacists as part of the extended primary care team. In the pack, we'll also include a little referral slip to inform the practice. Would be you're recommending basically that the patient should have a spacer with the metered dose inhaler, and the rationale why. So what we want to do is optimize the training and skills you have, and of course optimize the skills for the patient too, and keep it as simple as possible. The documents we have put together will give you simple explanations of what you can do to help the patient understand the importance of the spacer with the metered dose inhaler. And by doing the 60-second approach or the 2 to 5 minute approach, what you'll find is more GP practices hopefully will also value your skills and support that you can offer the patient. The patient will appreciate that you're looking out for them. And by doing that small intervention will lead to massive outcomes for that patient. One of the things we're all aware of is, of course, you've probably heard the expression antibiotic guardian, and there's this whole thing around us making a pledge of how we can make a difference. And for us to become spacer guardians, I think if we can make that pledge, 60 seconds, to make such a real difference to a person's life, and inhalers, optimal inhalers, does equal life for that person, that breathless patient, then what a great job, what a great deed we're doing. So what can you pledge to? Can you pledge to even 2 to 5 minutes if you have that time available in a community pharmacy? And that 2 to 5 minute pledge may end up leading to, and the 60-second pledge may end up leading to that person getting a prescription for a spacer Hi, Julia. I got your prescription ready for you.
Thank you.
And thanks for filling out that form. And I'm glad, yeah, I can see you filled out the part one that you haven't got a spacer. You've mentioned that you've got asthma there. That's fine. Today's date, that's fine. Okay, the patient information leaflet about the spacer form, did you manage to read that while we were waiting?
Yes, I did. It was very helpful. I think I need one.
Okay, well that sounds great, and believe it or not, hopefully, I mean, you can see the importance, but believe it or not, 9 out of 10 of us healthcare professionals may make a mistake when going through the 7 steps to good technique. So you can see why it's important. We'll do a referral slip for you to take to the practice to get a spacer.
Yeah, brilliant. Thank you.
Okay, thank you. Bye.
Bye.
Hi, Julia. So my name is Darush, and I'm one of the pharmacists based at the pharmacy here. I've just got your prescription ready for you, and it would be good just to go through the questionnaire you filled out. I can see you've done that. So it was just the one question. You've got asthma. Okay. I don't know whether you got a lot from that patient information leaflet, but what are your thoughts about the importance of a spacer with a metered dose inhaler?
Yeah, it looks really important. It looks like maybe I should have one.
Yeah, it's something that you're using your medicine morning and night, it seems, and it's something that you can use with your preventer treatment regularly, and also your emergency reliever inhaler as well. Believe it or not, 9 out of 10 of us healthcare professionals may make a mistake when using one of these inhalers by itself. And the spacer device will hopefully improve the amount of medicine that gets to your lungs and improve your lung condition as well, which would be a double bonus and minimize side effects, etc. But what would be good is if you're happy to take this referral form, or we can do it electronically ourselves, hopefully in the pharmacy, that this form will notify the prescriber to prescribe this. And once you're ready and happy, we can get that prescription ready for you and go through your spacer device. So we'll be able to go through the 7 steps of good inhaler technique, we call it. But before you go off and get your give this to the GP, what you can do is you can watch this inhaler video from Asthma UK, which shows you the normal technique that will be used by an adult as a sort of, we call it single breath and hold technique. So we can send that to you. You happy with that?
Yeah, can you send me a link, please?
I can indeed. We can do that electronically. So we have your details from the patient medication records. Is the contact details still the same?
Yes.
Okay, brilliant. So we'll arrange that for you. All right, nice to see you, Julia, and I look forward to seeing you next time, hopefully with your spacer device this time. So hopefully you got a good idea of how the making every contact count spacer guardian work how it can take place within the community pharmacy. It can take from 30 to 60 seconds. We showed one clip showing how short that was, or it could go to 2 to 5 minutes. The reason why you can go from 2 minutes to 5 minutes is if in the pharmacy, if we wanted to show and actually play the video from Asthma UK, and we have the link in your pack, so you'll have all that information to hand, you can show the patient the single breath and hold technique. And our role as part of shared decision making is to really fill in the gaps in knowledge and correct any misinformation. It's really about the patient being able to have an opportunity to ask questions, and maybe, if a person is prescribed a spacer, there's no guarantee that they're going to use it. So what we want to do is really get an idea of what's going on in that person's world and just find out, actually, is this a person who will make the most out of their inhaler and spacer? So when a person fills out the SPOT questionnaire, the spacer opinion questionnaire, we may get people disagreeing with some of the comments. Hopefully this shouldn't be a common occurrence, but if it does arise, it provides a really good opportunity to find out if maybe risky behaviours are occurring from the patient. And if obviously you do have time yourself and you have a specialist interest in respiratory yourselves, you may want to take this further with the patient yourselves too. This will be great for relationship building with our practices, as well as great for our patients, most importantly, because they can see what a valuable service we offer to them.